Hello, my dear future nursing officers. Welcome you all to the Master Nursing classes. In the last previous session, we have dealt the super important and a super fast and a super necessary questions and the concept that was necessary for your upcoming Norcet 9 mains exam. Right? In the today's session also, we are going to discuss the very important questions and the concept that is much necessary for your exams. And I'm wishing you all the best for your mains exams. Right, a very good evening to one and all who all are present in the session. So please hit the like button, then enter to the live zone. Okay, before entering to the live zone, so padafat hit the like button. Okay, and the today's class will be a very powerful class. The today's class will be a very motivating class. The today's class will be a class which is necessary for your Norcet 9 mains selection and the good rank. Right, so yes, a very good evening, beta. Good evening to one and all who are attending the live session. So fatapat hit the like button, then enter to the live zone. And who all are new to the master nursing classes, please do subscribe to the channel and hit the bell button. If you're hitting the bell button, then only the notification will comes to you. Okay, the regular timing of the classes will be updated in the WhatsApp channel and the WhatsApp groups. If you want, you can join there. Okay, so yes, with this powerful motivational line, I am starting the today's session. Students, please try to understand the situation that around of you, lots of the distractions are getting started. That may be a YouTube, that may be a WhatsApp, that may be a Telegram. You have only few and very few days for your mains preparation, and you are wasting a 1 hour, 30 minutes, 15 minutes also on your WhatsApp, Telegram, Instagram. Means you are wasting your golden minutes. Please consider. Don't get distraction. This is not a time to get distraction. This is a time to be very fully focused. So I am telling you have to consciously suppress all the distraction now. We have to strive your distraction now, and you have to only feed your focus. And don't go for the multiple source. You have to go for the one source which is very much genuine and where you are paying a 1 hour or the 2 hour time. So that should be a beneficial to you, right? So there are lots of the YouTubers, lots of the coaching centers. They are utilizing your time for their marketing purpose. So don't get trapped in that kind of the unnecessary situations, because this is a golden time. I told only one thing which help you now is the revision and the revision of the quality content and the plan I have told in the last class, right? So here, without wasting a time, I am starting the today's session. Okay, be completely attentive. Try to focus on the word where I am saying it is important. That's very important for your exam. You have seen in the prelims exam that wherever I have written, it is important, very and again very important. That question striked in the exam, that concept striked in the exam. Okay, so I am not going to waste your much time, and almost all of your friends, everyone have been joined already. And if any one of you wants to join, means you can share the link with them. Okay, they will also get joined. If possible, please keep this particular video in your WhatsApp status, right? So we will start the today's session now with this powerful motivational line. Strive your distraction now, and only how to feed your focus now, because a focused revision, planned revision, perfect revision is the only thing that will give you a selection. Okay, so with this powerful motivational line, I am starting the today's session. Okay, so here comes the first question in front of you all. Okay, and followed by every question there will be a golden point chanting will be there. That is necessary for you all, right? So yes, let's begin the real game now. Right, here is the question. What is the most commonly injured organ in a blunt abdominal trauma? In a blunt abdominal trauma, what is the most commonly injured organ in your blunt abdominal trauma? Option A is the liver, option B is the spleen, option C is the kidney, option D is the small intestine. So what is the correct answer? What is the correct answer? Yes, padafat. Whether it may be a right, whether it may be a wrong, whether you are in confusion, whether you are in completely confident, try to give the answer. If it is correct, yes, I will appreciate you. If it is wrong, I will correct you. I am here to make you perfect for your exams. Okay, so don't have to worry. Try to involve in the session and try to give the answer for every question. Yes, almost all you people chosen the option B as the correct answer. This is the Actually me, this is the correct answer. Okay, so if the question is coming, the most common injured organ in the blunt abdominal trauma is the spleen, and the most common overall also injured organ in the abdominal trauma, the most common overall injured organ is the, yes, again the spleen. Let me comes to the golden point chanting. Most common organ which are injuring in the abdominal trauma overall is the spleen. Blunt trauma, again the spleen. Penetrating trauma is the liver. Seat belt syndrome, that is the mesentery. Children's spleen followed by the kidney. Let me explain perfectly. Okay, yes, if this is the consider, this is the abdominal area, and here you are having the intra-abdominal organs inside, right? So if someone is coming and hitting, okay, and the thing which is not penetrating inside, means penetration means this is the sharp object I am pushing like this and which is going inside. So this is what we call as the penetration, right? So if someone coming and hitting, so there is no any penetration, it is not entering inside, so only the blunt injury will be there. That is what we call the blunt abdominal trauma. Okay, so by hitting with the blunt object, only blunt trauma will happen. In that situation, the overall most common organ to get damage is the spleen. Okay, then the blunt trauma, the most common organ injured in the blunt trauma is the spleen. Okay, and your own close friend, due to some financial issue, he is coming with a sharp object, and so he is inserting the sharp object inside your abdomen. Okay, consider this is called as the penetrating trauma. In the penetrating trauma, the liver will get damages. Remember, in the penetrating trauma, the liver will get damages, and you have become a nursing officer in the AIMS, and you are going with the 100 to 120 speed in a Tata Nexon 5-star car. Okay, with a complete seat belt. Suddenly, one person have drunken and he have came in front of you. You are in a 120 speed. Suddenly, you have put the brake on the car. That time, your own seat belt, which is there, that will make compression on your abdomen. So due to this seat belt inside the car, so your most common organ will get damaged is the mesentery. Mesentery means it is in the blood supply to your intestine. So that is the very important, right? So next comes to the children's, the most common organ is the spleen again, and the second most common organ to get damaged in the children's is the kidney. Hope it is clear to every one of you. Is that clear? Fatapat do thumbs up in the comment box. Is that clear? Is that voice, video, everything is clear, or is this concept is clear? Fatapat do thumbs up. Yes, well done, beta, well done. So yes, I am not going to waste your much time because I have the less time to teach you people. Okay, I want to cover the very huge and the very important concept before your mains exam. Okay, so the speed of the content delivery will be remains the same. Okay, if any one of you are feeling it is a very speed, so please keep this one in a 0.9 and you can watch till the next Norcet. Okay, don't have to worry about that, right? Just some students where they want the quality content in the short time with perfect explanation. So for them, I am I will be in this speed. Okay, so I hope it is clear, right? My concept will be very clear, even if it is slow, even if it is speed, right? So I have the very less time to deliver the quality content to you people. So I will be in a speed only, but with penetrative speed. Speed means if something I am telling and which is going above your head, that is not a speed. Penetrative speed means whatever the concept I told about the car, okay, about the penetration, about the blunt injury, this is what you call whatever I am explaining which is going to your brain. So that is what you call which is going inside your brain, that is the penetrative speed. So here will be a speed with penetration will be there. It will be definitely helpful for your exam, right? Yes, here comes to the next question. Please do read the question carefully, completely, and try to give the best answer. Yes. In a hemodynamically unstable patient with suspected abdominal trauma, what is the investigation of the choice? Option A comes here, the diagnostic peritoneal lavage. Option B is the focused assessment with sonography in trauma. Option C is the contrast enhanced CT scan. Option D is the plain abdominal X-ray. So what is the investigation of choice in hemodynamically unstable patient? Very important. I'm waiting for your answer. Well done, beta. Well done. In the hemodynamically unstable patient, both first investigation also and investigation of choice also. Investigation of choice is also an fast and the first investigation also is the fast. Very important. Keep in mind. So this is the table you have to remember here. Very important table. Right. So make the table like this in your notebook. First investigation in case of the abdominal injury. In case of the abdominal injury. Okay. So the first investigation, whether it may be a stable patient or unstable patient, first investigation should be always fast. What is the meaning of the fast? It is the focused assessment sonography in the trauma. Okay. So whether it may be a patient stable, whether it may be a patient unstable, the first investigation is always goes to be fast. But if the patient is stable, the investigation of choice is CCT. But if the patient is unstable, again the investigation of choice is the fast. So in the question what they have asked, the patient is unstable. So investigation of choice also fast and the first investigation is also fast. So answer goes to the option B as the correct answer. Hope it is clear to every one of you. And here will be the next question. What is the full form of the acronym EFAST used in trauma assessment? So we are assessing a patient with a trauma where we are using the acronym EFAST. For one investigation, we will call that investigation is the EFAST. So that is on the updated version of the FAST. Yes, what is the meaning of the EFAST? Option A is the emergency focused assessment with sonography in trauma. Option B, extended focused assessment with sonography in the trauma. Option C is the enhanced FAST. Option D is the emergency FAST. Yes, what is the correct answer? Well done, well done, well done. Very, very good. So this is what I'm very proud of you, dear students. You people are really excellent. Just now you have to be very confident and believe in yourself. Everything is possible. Definitely, the joining letter will be in your hand within 3 to 4 months after completion of the document verification. Okay, just be confident, focus on your revision. Only revision is the thing which is necessary now and which is necessary for your selection, right? So yes, almost all you people given the correct answer. That is the option B, extended focused assessment with sonography in the trauma. Beta, the fast we are doing here, that is to assess the any trauma which happened to the only in the abdominal area. Okay, so the EFAST what we are using, that is used both to assess the chest trauma and the abdominal trauma. Okay, so please do understand the difference between the FAST and EFAST. Okay, so full form of the FAST and EFAST is the a focused assessment with sonography in the trauma is the full form of the FAST, but for the EFAST, E stands for the extended, means we are extending the assessment till the respiratory area also. Okay, so extended focused assessment with sonography in the trauma. It is in the emergency USG we are doing to assess the what are the organ damaged, and if any bleeding is there, if any free fluid is fluctuating inside the abdomen, we need to check that one. We will use this ultrasonography in the trauma patient. Okay, so primary use to detect the free fluid typical in the abdominal injury. Okay, that is the function or the like use of the FAST. And similarly, in the case of the EFAST, we are assessing both free fluid that is in the chest also and free fluid that is in the abdomen also. Okay, so we are assessing both chest plus abdomen. We are assessing both chest plus abdomen for injury, that is with the help of the EFAST. Only we are assessing the abdomen. Only abdomen we are assessing. So this is what you call as the use of the FAST. Very important. Keep in your mind. It will be helpful for you. Okay. So hope it is clear to everyone of you. Right. The next is here in front of you. Please do read the question properly, carefully, correctly, then try to give the best answer. Which of the following is the most common complication of this splenectomy? There are the various situations we need to go for splenectomy, and even after some intra-abdominal damages where the spleen is get damaged, because the spleen is the most common organ to get damaged in the overall abdominal trauma and in the blunt abdominal trauma, that is the spleen. If the spleen is ruptured inside, if the spleen is ruptured inside means yes, the splenic artery is the direct branch of the abdominal aorta. It will bleed heavy. Okay, so there will be a excessive bleeding will be there, right? There will be excessive bleeding will be there. But if someone is asking the most common complication, of the splenectomy, your primary answer should go to the atelectasis. Is your primary answer. Why atelectasis happens? I will explain. Don't worry. But if someone is asking the question, most common complication happens during the surgery. Hemorrhage is the during the surgery. The bleeding will happening, so that's the hemorrhage. Okay, but after the splenectomy, okay, the complication if someone is asking, that's the atelectasis. For this particular question, correct answer goes to the atelectasis, and all these are the complication of the splenectomy. Okay, so these all four. Hemorrhage is also complication of the splenectomy. Atelectasis is also complication of the splenectomy. Opsy is also complication of the splenectomy, and the pancreatic fistula also complication of the splenectomy. In a splenectomy case, the most common complication is our atelectasis is the most common complication. Sir, how? Sir, why? Listen. So this will be our diaphragm, the main muscle of the respiration, and here on the diaphragm we have the two beautiful lungs, right? Two beautiful lungs are there on the diaphragm, and here will be our spleen is there. Okay, here will be our spleen is there, and here is the pancreas. Okay, so this particular spleen is just below the a very important costal margin, or it is just below the our diaphragm at the level of the 10th and 11th intercostal space. Okay, if the person is trying to inhale the breath, he is trying to inhale, so that time these lungs will create pressure on this particular incision area or a surgical area. That time the person will feel pain. Okay, so due to this pain, the person will avoid the deep breathing after the splenectomy. So after splenectomy, the person is not doing deep breathing, means already there is the effect of the anesthesia is there, the respiratory muscles are weak and the respiration becomes the sluggish, right? But along with that, a patient is trying to take deep breath. That time the patient is having the increase in the pain at the surgical area. So again he will avoid the deep breathing. So he is avoiding the deep breathing means the patient will be getting the landing into the atelectasis. That's the collapse of the lung alveoli, the most common complication of the splenectomy. Very, very important. Please keep in your mind. Okay. Yes. This is the very important thing you have to keep in your mind, right? The next question is here in front of you all. So try to answer the question properly, carefully, correctly. Okay. So the question is important. It is very, very, again, very important question for your main section. Yes. Which of the following vaccines is recommended for a patient after splenectomy to prevent opportunistic post-splenectomy infection? Students, you have to understand the concept of the OPSI. Then only you will understand the entire process, why we need to give the vaccination before the splenectomy. Before removing the spleen, we need to send the patient for the two very important vaccines, that is the vaccine against the pneumococcal and the vaccine against the influenza, right? Sir, why? Why? Because consider this is our spleen, this particular spleen, which is having a very important function to destroy uncapsulated bacteria. Sorry, to destroy the all capsulated bacteria. Right? The spleen is there, means the capsulated bacteria which is coming from the blood into the spleen. So for the filter purpose, this spleen, it will destroy the capsulated bacteria. If we done the splenectomy, means we have removed the spleen. So now the spleen is not there. Okay, the spleen is not available. Spleen is not available because we have done the removed the spleen surgically. That is the we have done the splenectomy. Now spleen is not available. So there is no any destruction for the capsulated bacteria. The capsulated bacteria will keeps on growing inside the body. The capsulated bacteria are the most important one is the pneumococcal and the influenza. So these are the capsulated organisms which are very important for our exams. Okay, so this will not destroy. This will not destroys the infection risk of this particular organisms will increase. So that is the reason before doing the splenectomy we will recommend to go for the pneumococcal vaccination and the influenza vaccination. So if we are giving the vaccination against pneumococcal infection and the influenza, so there is the risk of this capsulated bacteria infection will be reduced. Okay, so the infection will be reduced means post splenectomy opportunistic infection which is happening that will also get reduced. So that is the reason which vaccine we will give in a patient after splenectomy to prevent the opportunistic post splenectomy infection means. So post splenectomy means after the splenectomy infection is happening by the capsulated bacteria. So that is the pneumococcal and other influenza bacteria. So in that one, we are giving the pneumococcal vaccine and the influenza vaccine. Among these options, we will choose for the pneumococcal vaccine as the correct answer. So this will be your very important question for your upcoming exam. So here the question will strike in the exam. Hope it is clear to everyone of you, right? So the next question is here. Yes, again very important question, right? A Springer's maneuver is used to control the bleeding from which of the following structure? Option A, inferior vena cava. Option B, hepatic artery and hepatic vein. Option C, splenic artery and splenic vein. And option D is the renal artery and renal vein. So which part we are compressing by using the Springle maneuver to stop the bleeding? Beta, if any damage which happens to the liver, so the bleeding will happen hugely. Okay, in order to avoid the bleeding, so we are using a maneuver and we are compressing at the this particular foramen of the Winslow. Okay, are you able to see this particular foramen of the Winslow, this hole here? In this particular hole there are the entry of the three things. One is hepatic artery, one is hepatic vein, and another one is the common bile duct. Okay, so these three very important structure which enters into this Winslow, or we can say foramen of the Winslow. Okay, foramen means hole. Okay, so this is discovered by the scientist called as the Winslow. So we call this one as the hole of Winslow or the foramen of Winslow. In this particular area, these all three structures will enter. That is the hepatic artery will enter, and hepatic vein will enter, and then common bile duct will enter. Okay, during the liver injury, if bleeding is happening uncontrollably, we need to do the Springle maneuver. It means we need to press with the finger very deep in this particular foramen of the Winslow to stop the bleeding. So that is what you call as the Springle's maneuver. So Springle's maneuver we are using to compress the hepatic artery and the hepatic vein and the common bile duct in order to stop the bleeding. Okay, so in order to stop bleeding from hepatic damage or the liver damage. Very important. Keep in your mind. Okay, so that is the Springle maneuver we are using here. Hope it is clear to everyone of you, right? So here will be the next question. Which of the following best defines an autograph? So among the given following option, which of the following is best defines your autograph? Autograft. Option A is the graft taken from the one individual and placed on the another individual of the same species. So this is what we call as in the which graft? This is option A is which graft? Yes, this is the allograft. Okay, so this is a case of the allograft. Very important. Please to consider. Okay, I will revise in the golden point chanting. Don't worry. Then the option B That's the graft which are taken from the an animal and which is placed on the human. So which option B is which kind of the graft? Yes, option B is which kind of the graft? Yes, very good. That is the a kind of the xenograft. Okay, so the next option C is the graft taken from the one part of the own body and placed in the another part of the same individual. Okay, so for me, consider just facial reconstruction skin is required. Okay, now that doctor will take a skin from the thigh and he will place it here. The surgeon will take a skin from the thigh and he will place it here. Okay, my own skin he is taking from the another part of the body and he is placing over the another part of the body. That is what you call as in the autograft. Okay, autograft. Own body part which is taking for the grip grafting, that is the autograft. Okay, so for this question correct answer is a C. So almost all you people given the correct answer for this question. Okay, so I'm very proud of you, right? So let me comes to the golden point revision on the types of the graft. Only very important thing you have to remember here, the autograft means same person. Okay, one different part of the body I am taking the skin and in another part of the body I am placing the skin. I told from the thigh we will take the skin and we will use that one for the any chest skin repair or the facial skin repair. Okay, that is what you call the autograft, right? Allograft means same species but different person. Okay, so same species but the different person means human to human but not from the cell. Okay, from here from this donor we are taking the skin and for this recipient we are giving the skin. So this is what we call the skin grafting in a different person but same species. He is also human, he is also human. So that is what we call the allograft. And the xenograft is the from the different species, means from the fig I am taking the skin and I am placing the skin on your face. Fig is not a same species like you. You are human being and fig is different species, right? Yes, so that is the reason. Just for comedy purpose, okay, don't take it serious. So this is not a fig, this is the page fig, okay. So I'm writing figure here, okay. Yes, the pig is a different species. So from here I'm taking the skin and I'm placing over the human, means this is what we call the taking from the different species or from the animals, we can say the xenograft, very important one. Okay, then the isograft is the genetically identical twins. Okay, so the twins I am taking. So here's the Ram and here's the Sham who born one time. Okay, so from this particular person I am taking the skin and I am this particular child I am giving the skin, means in between the twins the skin sharing is there for the graft purpose. That is what we call the isograft. Okay, and the genetically identical individual twins. Okay, so in this particular area, so identical twins we are exchanging the skin, means that is what we call the isograft. Okay, so hope it is clear, right? So option is telling taking the skin from the individual with the same species. I told this was the case of the allograft, same species. Okay, skin taken from the animal and placed on the human, that is the xenograft. Okay, and synthetic graft material used for the replacing the tissue is the synthetic material we are using, which is there in the factories. Okay, and from the identical twins we are exchanging the skin, we are using the skin for the grafting, means that is the very important isograft. Okay, so hope it is clear to every one of you. And here is the next question. Yes, what is the primary reason for adding the adrenaline or we can say epinephrine to lignocaine in the local anesthesia? Okay, in the local anesthesia, so we are using the adrenaline or the lignocaine. So what is the primary reason for adding the adrenaline or the epinephrine to lignocaine before anesthesia, before injecting the local anesthesia? What is the correct answer? Yes, option A, to increase the systemic absorption to the drugs. Option B, to reduce the pH of the solution. Option C, to prolong the duration of the anesthesia. And option D is the to prevent the allergic reaction. So what is the correct answer? Students, nowadays we are getting the vial of the local anesthesia where it is already pre-mixed. Okay, where it is already pre-mixed. Okay, so the vial will comes with like adrenaline plus lignocaine. What is the purpose of adding this adrenaline? in the lignocaine. Means this adrenaline, every one of you know, which is having the sympathetic effect, and it will do the vasoconstriction. It will do the vasoconstriction. Means the local anesthesia which we are injecting, that will not suddenly get absorbed. If the vasoconstriction, consider here I given the anesthesia, okay, and here I given the adrenaline. Means for this particular area, the blood supply will get decreases. Why? Because the vasoconstriction have been happened. In this particular lignocaine or the local anesthesia, what I have given, it will not suddenly get absorbed and it will not suddenly get destroyed. Okay, so it will be there at the site for a prolonged time, and it will increases the duration of local anesthesia. Okay, that is the very important. So which increases the duration of the local anesthesia. So that is the reason in the adrenaline, yes, almost all you people given the correct answer. That is the to prolong the duration of the local anesthesia, we are giving the adrenaline along with the lignocaine in the local anesthesia. So this is the golden points you have to remember. The dilution of the adrenaline at the site of the local anesthesia along with the lignocaine is that is the 1:2 lakh. Okay, so adrenaline dilution is the 1:2 lakh we have to do here, and it is the local vasoconstrictant. Okay, and it is contraindicated in the artery and like end arteries. Okay, so consider this is our finger, this is our earlobe, and this is the finger and the penis areas. So what happens? There is in the arterial supply will be there. Okay, there is the arterial supply there which will end here only. Okay, if I am giving the local anesthesia here and vasoconstriction here doing means arterial constriction I am doing here means, so for this particular fingers, for this particular earlobe and the penis areas, the blood supply will get stopped. Okay, that is the reason whenever we are try to make the local anesthesia at the area of the end artery damage, end artery available in that particular area only, we will use the plain lignocaine only. We will not use the adrenaline in the end artery area. Okay, so especially the earlobe, finger, and the penis areas. Okay, in order to give the local anesthesia, don't use lignocaine, because at the end artery is constricting, means there is no any collateral circulation to supply the blood. Okay, so that is the reason we are not using the adrenaline. Sorry, don't use the adrenaline, not lignocaine here. Okay, don't use the adrenaline at the end artery area, especially the earlobe, fingers, and the penis. Okay, so very important, please do consider. And one more very important point, note it down. Adrenaline and lignocaine together we will not give in the patient with hypertension. Okay, patient with history of the hypertension, so we will not give adrenaline plus local anesthesia, that is the lignocaine. Okay, so why? Because the adrenaline is a sympathomimetic, means sympathetic nervous system will increase. Again, the hypertension will increase. So that is the reason if the patient is having the history of the hypertension, not give the adrenaline with the local anesthesia. And if the at the area where the end arteries are there, like earlobe, fingers, and penis, so do not give the adrenaline. We are using only the plain lignocaine in this area. We are using the only plain lignocaine in this area. Very important. Okay, so all the golden point chanting we have done here. Okay, and here is the next question. What is the full form of acronym, that is the EMLA, used for the topical anesthesia? Okay, beta, if you want to insert the IV cannulation without any pain, so that time we will use one ointment or the cream. That cream or ointment name is called as the EMLA. So what is the full form of this acronym EMLA? Option A, epidural mixture of lignocaine and adrenaline. Option B, external mixture of the local anesthesia. Option C, eutectic mixture of the local anesthesia. And option D is the enhanced mixture of the adrenaline application. What is the correct answer? Yes, I'm waiting for your answer. What is the correct answer, guys? Well done. Okay, so that is the EMLA cream. Full form is the eutectic mixture of the local anesthesia. So what is it meaning, sir? So here we are equally eutectically mixturing the short acting local anesthetic agents. Okay, I am applying that particular agent over this particular skin for the 30 minutes to 1 hour before, and I am maintaining the compression dressing. Means after 30 minutes to 1 hour, this area become completely numb. Okay, since like there is no sensation. So here you can insert the IV cannulation without any pain. Okay, so in situations like a painless IV cannulation. Okay, so we are using the EMLA cream. EMLA means here the eutectic mixture of the local anesthesia. Okay, it applies before 30 minutes or the 1 hour before the IV cannula insertion. So the composition of the EMLA or EMLA contains, or the eutectic mixture of the local anesthesia contains a lidocaine 2.5% and the prilocaine 2.5%. Both are the short acting. Okay, so local anesthetic agents. So we are using this one, okay, for the very important painless IV cannulation, the EMLA cream. The question was asked on the time duration to time duration to apply the EMLA cream before the IV line insertion. That is the 30 minutes to 1 hour. In the question, if they are mentioning what is the minimum time contact between the EMLA cream and the skin for the painless IV cannulation, in the question they have mentioned the minimum contact time. Answer will be 30. Okay, so 30 minutes. Right? If they are mentioning the standard time we need to maintain for the painless IV cannulation, that is the contact between the EMLA cream and the skin is the 1 hour. The standard time and the maximum time is the 1 hour, and the minimum time at least we need to wait for the 30 minutes. Based on the question, how the examiner is asking, based on that the answer will be goes, right? So very important, please consider in your mind. Right? Here's the next question. The question is in front of you all, so please do read the question carefully, completely, then try to give the best answer for this question. Which of the following spinal level is spinal anesthesia most commonly administered in adult? Which of the following spinal level is spinal anesthesia is most commonly administered in the adult case? In a adult case, option A T12 to L1, option B L4 to L5, option C L3 to L4, option D L5 to S1. Beta, if the examiner is asking the lumbar puncture site and the spinal anesthesia site in the children's, so that is in the children's L4 to L5. If examiner asking the question in adults, so that is the L3 to L4. Okay, very important. Please do consider in your mind, right? So here is the golden point chanting, beta. Please do remember in the spinal anesthesia and the lumbar puncture. Okay, in both cases, spinal anesthesia and in the lumbar puncture, in the both the cases, the best site of insertion of the needle in the adult is the L3, L4, and the best site of insertion of the needle in the children is the L4, L5. Okay, it is the important one. It is the important one. Okay. Please don't forget, beta. It is important one. Right? In the children, L3, L4. So in the adult, L3, L4, and in the children, L4, L5. Okay. So this is a very important one. Right? So same site for the lumbar puncture also, same site for the spinal anesthesia also. Okay. So keep in your mind. And here is the next question. The scenario based question. Which of the following position is most appropriate immediately after performing a lumbar puncture to help to reduce the risk of the post-dural puncture headache? To help to reduce the post-dural puncture headache, which position we have to give here? Yes. Which of the following position is most appropriate immediately after performing the lumbar puncture to prevent the risk of the post-dural puncture headache? Yes, why the post-dural puncture headache happens? So this is the headache which happens at the occipital area. So whenever we will insert the needle behind the epidural space, means if we are breaking the epidural space, means we are going into the subarachnoid space. So we are going into the subarachnoid space, means there will be a CSF leakage will be there. Okay. So CSF leakage will be there. So due to the leakage of the CSF, Okay, so there will be a headache will be there. Okay, there will be a headache will be there. So we call this one as the headache which happening due to the after lumbar puncture. So I call this one as the after means post dural puncture headache. Okay, so in this particular situations we will give the supine positions with a flat positions without any pillow. Okay, supine position without pillow is the position where we need to give to reduce the headache here. Okay, so that is the very important thing you have to keep in your mind, right? So due to this CS leakage which is happening, so we are giving the position that is the supine, that is the lying flat without pillow is the position we will give to reduce the lumbar puncture induced headache. Okay, so very important one, please consider, right? So the next question is here: which of the following inhalational anesthetic agent is stored in vaporizer with yellow color code? Which of the following inhalational anesthetic agent is stored in a vaporizer with yellow color code? Very important. A color of the inhalational anesthetic agents. Beta, in the yellow color code, whether we are using the halothane or the isoflurane or the sevoflurane or the desflurane. Which one? Beta, for the desflurane we will use the blue one. We will use the blue one. So the desflurane is not answer. So go for the next answer. Yes. For our halothane we are using the red one. Okay, this is also not answer. I am eliminating. So I am giving the only two options: isoflurane, sevoflurane. Yes. Well done. Sevoflurane goes to the correct answer. In the sevoflurane only, the in yellow color code one. So we are using the sevoflurane. Okay, so it will looks like this. Okay, look at this, the inhalational anesthetic bottles. The blue one. Okay, so blue one and the brown one and the yellow one. So the red one also will comes like this only. Okay, so remember here the halothane is the red one and the isoflurane is the purple one and the sevoflurane is the yellow one, desflurane is the blue one and eflurane is the orange one. So now we have to remember the orange color one, that is the eflurane. Okay, and one more Entanox also have came. Okay, so that is also very important one, that is also orange color. Okay, so remember desflurane is the blue one, sevoflurane is the yellow one, isoflurane is the purple one, halothane is the red one. Okay, so this is the image of the inhalational anesthetic agents. Okay, these are the image of the inhalational anesthetic agent. Okay, so very important. So in the inhalational anesthesia, one anesthesia we will call as the laughing gas. So what is the laughing gas? What is the laughing gas? In the inhalational anesthesia, one agents we call as in the laughing gas. So which one we will call as the laughing gas? Remember. Laughing gases. Yes. That is the nitrous oxide. Very important. The nitrous oxide we also call as in the laughing gas. That is also part of the inhalational anesthesia. So I am giving a 5-star for this one because it will be struck in your exam. Okay. So please do remember. Very important. Okay. Yes. Yes, almost all you given the correct answer. So here is the next question. A red colored cell is placed in a hypertonic solution. That is the hypertonic sodium chloride. So what is the most likely outcome of this particular situation? Now what happened? So here is the a bottle of the hypertonic sodium chloride. So in this one I have kept the RBC. Okay, so already solution which is there inside is the hypertonic, means it is having the highest solvents. Okay, which is having the highest solutes. Okay, so which is having the highest solutes means the concentration here is the more concentration is there. Okay, the solution is there inside. So inside the solution there is the most concentration will be there. So this is what we call the hypertonic solution. Okay, we call this one as in the hypertonic solution. So in this hypertonic solution what happens? So as compared to the cell inside a fluid, outside fluid is having the more solutes, means which is having the more osmolality, which is having the more of concentration, means it will pulls the fluid from inside the cells to the outside the cell. Okay, so that it will get balance. Okay, it will pulls the fluid from the inside the cell to the outside the cell. So that time the cell will what happens? Cell will get shrink here. Cell will what happens here? Cell will get shrink here. So cell is getting the shrink means cell is getting the decrease in the size. So that's what happens when you will place the red blood cells in the hypertonic solution. Cell will get shrink here. Okay, comes to the option A, hemolysis due to the cell rupture. But a cell will rupture when the cell will get swelling. Okay, so that is the cell swelling. The cell rupture will happens. No changes in the cell volume. Better changes in the cell volume happens because the outside fluid is highest in the solute. So it will pulls the fluid from inside cell to the outside the cell. Okay, means the cell will get shrink here. Okay, so cell swelling due to water influx. No, the water is not getting influx. The water is getting efflux, means it is going outside. So the shell is getting shrinkage due to the water loss. So this is goes to the correct answer in the, if you place the like RBC in the hypertonic solution, this is the concept what happens. Similarly, please do remember the concept here behind this one. Okay, so understand. This is the blood vessel you consider. Okay, and this one is the cell. This one is the cell, this is the blood vessel, and now you are inserting the IV cannula here, and you are giving the 3% normal saline. You consider 3% normal saline. So this is the example of the hypertonic solution. This is the example of the hypertonic solution. Okay, hyper means increased, tonic means tone. So the solutes will be increased here, or the tone will be increased here. Okay, so tone will increase means the viscosity of this particular blood which is there inside will be increased. The viscosity increased means the Gadapanthi. Okay, so the less diluted and the more concentrated fluid will be there here. Okay, so the fluid which is having the more solutes, or the fluid which is having the more concentration, or the fluid which is having the more viscosity, what it will do to get diluted, so it will pull the fluid. It is more concentrated means it should get dilute. Okay, for the maintaining the good balance. Okay, it should get dilute. So to get dilute, what it will do, it will pulls the fluid from the cell into the blood vessel. Okay, in the hypertonic solution, what happening, the cell is shifting from the intracellular space to the intravascular space. It means the cell is coming from the extravascular space to the intravascular space. Yes, extravascular means the cell which is inside the like the fluid which is inside the cell, means outside the blood vessel. Okay, or the fluid which is there in the interstitial space. So this fluid all called as the extravascular fluid, means the fluid which is there outside the blood vessel. So that is called as the extravascular fluid. So now I am giving the 3% sodium chloride, means the hypertonic solution I am giving, means here the tone increased. So to get decrease its tone, or to get dilute this fluid, so the fluid will shift from the inside the cell to the outside the cell, we can say, or from the extravascular space to the intravascular space. So now the fluid is going, or the fluid is effluxing, not influx. Influx is coming in. Efflux means going out. Okay, the fluid is going from inside the cell to the inside the blood vessel, means which is going outside the cell. So now the cell size will get decreases due to the loss of the volume of the fluid. Okay, so you are giving the hypertonic solution, means what happens to the cell. So in case of the hypertonic solution, the shell will get shrink. Okay, shell shrinkage will happens. Very important. Okay, so please note it down. Okay, so very important one, right? Similarly, if the patient is having the cerebral edema, you consider, means inside the blood vessels of the brain there is an accumulation of the fluid is there. So now I want to reduce a edema from the brain cells. Okay, means I want to remove the fluid from the brain cells. So which fluid I will give? I will give the hypertonic solution. So I am giving the hypertonic solution, means it will sucks all the fluid from the brain cells inside the vessels. Okay, so along with that I will give the diuretic. So the fluid which is coming inside the cell, means to the inside the cell into the inside the blood vessel, means it will comes to the kidney. So the diuretic will eliminates the excessive fluid. Okay, so in the cerebral edema, okay, we will give the hypertonic solutions. Okay, along with that we will give the mannitol also. So the mannitol is the pollide. Okay, so it will also pulls the it is also osmotic diuretic. Okay, so that it will pulls the fluid from the cell into the blood vessel. It will take Okay, from the blood vessel it will comes to the kidney, and the mannitol also diuretic, it will eliminates. Okay, so mannitol and the hypertonic solutions we will give in a case of the head injury. Okay, so we will give in a case of the head injury treatment for treating cerebral edema, we will give the hypertonic solution. So it is the very important one, please consider in your mind. Okay, so very important. And here will be the next concept that you consider. Now you are giving a fluid which is hypotonic. Okay, so consider this one is the blood vessel. Consider this one is the blood vessel. Okay, and here we have the beautiful cell. So here will be the cell. Okay, so now I am inserting the IV cannula and I am giving the injection. So that is the a very important one, or we can say the infusion of the hypotonic solution. I am giving the hypotonic solution. For example, 0.45 percentage normal saline I am giving. Okay, so I am giving the hypotonic solution or the 0.45 percentage normal saline I am giving. So that time what happens? This fluid will go here inside. Okay, the fluid will be gone inside the blood vessels. Okay, so after administration of this particular fluid, it went inside the blood vessels. But this is the hypotonic, means the tone is very less. The concentration is very less, or we can say the complete diluted fluid is there inside the blood vessel. But here inside the cells there is the more tone, or the more Ghadapantya, or the more viscosity will be there. Now this particular cell, in order to dilute this particular concentration as compared to the blood vessel, the cells are having the more solutes. Okay, so that is the reason this fluid will shift from inside the blood vessel to the outside the blood vessel. Okay, or we can say from the from the extracellular space to the intracellular space. Okay, so which is coming intracellular space. Okay, in the intracellular space which is coming means, so cell size will get increases. Okay, so cell size, it will get increases like this. Okay, this is what we call the cell swelling. Okay, what we call this one? We call this one as the cell. This was the size previously. Now this cell is getting increased because the fluid is coming inside this particular cell. Okay, so fluid is coming inside this particular cell because it is in the hypotonic. In order to dilute the intracellular space, it is coming inside the cell. So if you are giving the hypotonic solution, the cell will get swelling. Okay, what happens to the cell? Cell will get swelling. Okay, cell will get swelling means the cell will get rupture. Cell will get rupture means cell will get lysis. Okay, so this will happen here. Very important, keep in your mind. Okay, so this is the use of the hypotonic solution. So one more solution which will come here is the isotonic solution. Okay, so in the isotonic solution, again you consider this is the blood vessel. Okay, and here is the cell. This is the blood vessel, and here is the cell we have. And now I am giving the 0.9% of the normal saline. So this is the isotonic saline. Okay, what is this? This is the isotonic saline. So now I am injecting this one inside, or infusing this one inside the blood vessel. So it is now here. Means it is not completely dilated, it is not completely concentrated. It is as similar to the plasma volume. Okay, it is not dilated also, it is not concentrated also, it is looks like a plasma osmolality, same as plasma osmolality, right? So it is same as plasma osmolality. It will not shift from blood vessels to the cell also, it will not go, or from the cell to the blood vessel also it will not come. So there is no shift of the fluid. Okay, so there is no shift of fluid which will be seen in case of the isotonic solution. If you are giving the isotonic solution, iso means similar, tonic means, okay, so it is a similar to the tone of the plasma volume. Okay, So isotonic solution, it will not shifts the any fluid from inside the cell to the outside the cell. Okay, and in case of the hypertonic solution, the fluids hypotonic solution, the fluid is shifting from the blood vessel into the cell, so that the cellular swelling is happening and the rupture of the cell is happening. Okay, and in another situation, that is the hypertonic solution, a blood viscosity is more, so from because of that the fluid is coming from inside the cell inside the blood vessel. Okay, so yes, from the intracellular space to the intravascular space it is shifting, or we can say the intracellular space to the extracellular space it is shifting. Okay, very important. Similar here. Okay, so the three very important isotonic, hypertonic and hypotonic fluid concept you have understood. Okay, consider. So this is the golden point revision. In the hypotonic fluid, what happens? In the hypotonic fluid, what happens? Water moves from the water moves into the cell. Okay, so I told in the hypotonic solution, the water is moving inside the cell. Okay, so because of that the cellular swelling is happening and the cell may get burst or the cell may get rupture. Right, the cellular swelling is happening or the cellular lysis is happening because of the hypotonic solution. Please do remember. Okay, then in the hypertonic solution, what happening? Water is moves out of the cell. Okay, so I told water is moving out of the cell in the hypertonic solution. In the hypertonic solution, water is moving from the inside the cell to the outside. So the water is moving outside the cell means the cell will get shrinkage. Okay, the cell will get shrinkage and it will get free nets, means it will get decrease in the size. Okay, so that is the next isotonic one. Okay, in the isotonic solution, what happens? There is no any net water movement. The fluid will not shift from the intracellular to extracellular or the intravascular to extravascular. Okay, cell size remains same in the isotonic fluid. Okay, so this is your very important concept for your upcoming Norcet exam. Okay, so please do consider this concept. Hope it is clear to everyone. Right, here is the next question. Yes. What is the approximate osmolality of 0.9% normal saline, and why is it considered as isotonic? So the question is very simple. The osmolality of the normal saline 0.9% is how much it is, and why we call this one as in the isotonic. Better, I told the plasma osmolality and the fluid, the IV fluid which we are giving like normal saline, where the osmolality of the plasma and the osmolality of the particular, what we can say, the IV fluid is equal, means we call that one as the, or which is matching, we call that one as in the isotonic. The IV fluid which is having the more concentration or the more osmolality as compared to the blood plasma, that is what we call the hypertonic. Okay, the IV fluid which is having the less concentration or the less solutes as compared to the blood plasma, that is what we call the hypotonics. Right, so what is the meaning of the isotonics? The osmolality of the IV fluid and the osmolality of the plasma should match each other, then only we call that one as in the isotonic. Okay, so the osmolality of the 0.9% normal saline is the, that is the 308 milliosmol per liter. And why we call this one as the isotonic? Because it is matching to the plasma osmolality. Okay, so students, I told the sodium chloride or the IV fluid 0.9% normal saline. I told the osmolality of this particular IV fluid is the 308 milliequivalent per liter. Okay, so here it is 308 milliequivalent, means in this one there will be a sodium will be there, and here will be the chloride will be there. So the sodium chloride is the composition of the NaCl. Okay, so here in this one 154 milliequivalent is the sodium and the 154 milliequivalent is the potassium. Okay, sodium is 154, potassium is, sorry, chloride is the 154. The total is the 308. Okay, so what is the normal plasma osmolality? It is the 285 to the 295 milliequivalent per liter. Okay, so that is the normal plasma osmolality. Again, the both are looking near or the approximate or the same. Okay, so that is the reason this 0.9% is normal saline. We also call this one as the, it is equal to the normal plasma osmolality. So So we call this one as the isotonic solution. Okay, so that is the reason the both are matching here. So that is the reason we call this one as the isotonic solution. Hope it is clear to everyone of you, right? So here is the next question. Yes, which of the following best describes the composition of the Ringer lactate solution? So among the given all the options, which of the following is the best describing that it is in the composition of the Ringer lactate solution or it is in the composition of the RL solution? What is the correct answer? Option A, sodium, chloride, no potassium and calcium. Option D, sodium, chloride, potassium, calcium and the lactate. Option C, sodium, chloride, potassium and bicarbonate. Option D, sodium, chloride, potassium and the magnesium. What is the correct answer? Guys, what is the correct answer? Yes, the composition of the Ringer lactate solution. We also call this RL solution. What is the name? Another name of the RL solution? Yes, Ringer lactate solution is also called as Hartmann solution. So please do remember, what is the name of the RL solution? Another name. This is what you call as in the Hartmann solution also. Okay, if the examiner asking the composition of the Hartmann solution, don't get confused. He is asking the composition of the Ringer lactate solution. So in this one, we are having the sodium also, chloride also, potassium also, calcium also, lactate also. Okay, so that is the reason. This is a very important fluid where we will give in a case of the metabolic acidosis, the fluid of choice in the metabolic acidosis. But we will not give in the lactic acidosis. Please do remember, it is in the fluid of choice. Fluid of choice in metabolic acidosis. Sir, why, sir? Why it is the fluid of choice, sir? Yes, remember, in this one, we are having the lactate. Okay, this lactate after metabolism, it will get converts into the bicarbonate. Okay, this bicarbonate is the thing which will helpful for the treating the metabolic acidosis. Okay, so bicarbonate increased means metabolic acidosis will get decreases. Okay, so that is the reason the fluid of choice in a case of the metabolic acidosis is the Ringer lactate. But it is having the lactate inside. So in case it is having the lactase inside, so it is contraindicated in the lactic acidosis. It is RL is contraindicated in lactic acidosis. Please do remember this two very important golden point. The fluid of choice in the metabolic acidosis is the metabolic acidosis, that is the Ringer lactate is the fluid of choice in the metabolic acidosis, and this is the fluid where we will contraindicated in the lactic acidosis is the Ringer lactate. Okay, so very important. And this is the fluid of choice in a case of the Burns patient. Fluid of choice in a case of the Burns patient is the Ringer lactate. Okay, so let's come to the composition. Here in these compositions, they will ask the potassium amount in the Ringer lactate. Okay, so please do remember the potassium amount in the Ringer lactate. It is the 4 milliequivalent per liter is the potassium which is there inside the Ringer lactate is the 4 milliequivalent per liter, not per 1 point. Okay, so it is per liter, very important, right? The sodium is 130 milliequivalent, chloride is the 109 milliequivalent per liter, and the potassium is the 4 milliequivalent per liter, and the calcium is the 3 milliequivalent per liter, and the lactate is the 28 milliequivalent per liter. In your exam, these two components only will ask in your exam. One is the amount of potassium in the Ringer lactate fluid. Amount of potassium in the Ringer lactate fluid is the 4 milliequivalent per liter is the amount of the potassium in the Ringer lactate fluid. So this is the 5-star question. Okay, then comes to the amount of the lactate. Amount of the lactate in the Ringer lactate fluid is the 28 milliequivalent per liter. So this is again also a 5-star question which will be asked in your exam. So please do remember this both 5-star questions. Okay, so amount of the potassium inside the RL is the 4 milliequivalent per liter. Amount of the lactate inside the RL fluid is the 28 milliequivalent per liter. So this is the very important thing, just you have to keep in your mind. Okay, hope it is clear to everyone of you. And here is the next question, and here is the update yourself for your mains exam. Okay, so already just before the prelims exam, I shared one notes in my WhatsApp channel. Okay, so this notes, are you people remember these notes? Yes, how many of you have read these notes? In the WhatsApp channel, we sent the same notes of the SRS, the sample registration system 2025 new updates. Just one day before the prelims exam I have shared, because this question is very important. Okay, so again for your mains exam, definitely one question will be struck from this SRS 2025 guidelines. Definitely one question. Okay, so please consider this one is in the 10-star topic. This is the 10-star topic, beta. Very, very important. Please consider. Very important. What is the, according to the sample registration system 2025, what is the neonatal mortality rate? What is the neonatal mortality rate in India per 1,000 live birth? Option A 18.4, option B 6.4, option C is the 19, option D is the 25. What is the correct answer, beta? Yes, the correct answer is 19 neonates are dying per 1,000 live birth, according to the sample registration system 2025 new updates. Okay, so this 18.5 is our 18.5 is this 18.4 is our crude birth rate. Okay, the crude birth rate is the 18.5 birth is happening per 1,000 live population. Sorry, 18.4 live birth is happening per 1,000 live population. So this is according to the new update of the sample registration system. Okay, so this one only will be asked in your exam. Okay, so crude birth rate is 18.4 and the crude death rate is 6.4 deaths happening per 1,000 live birth. Okay, so then the total fertility rate is the 1.9. Then the infant mortality rate, the 5-star question. That's the infant mortality rate. This notes already have shared in the WhatsApp channel. So if any of you have not seen that one, so you can scroll down, you will get that. Okay, so yes, you can paste it on your wall and send me a photo. Right, infant mortality rate IMR is the 25 death per 1,000 live birth. Okay, 25 deaths are happening per 1,000 live birth. That is the infant mortality rate. Okay, so then the maternal mortality rate, the 1,000-star important point for your exam. The maternal mortality rate, the 1,000-star important question for your upcoming exam now. Very important. It is not 1-star, 2-star. It is a 1,000-star important. Okay, better. It is very, very important. Please remember the maternal mortality rate as per the sample registration system 2025. So that is the how much it is the maternal mortality rate as per the new, very important sample registration system 2025. So this is your assignment question, right? So please try to mention everyone. That is the 88 per 1,000 live birth. Sorry, for 1 lakh live birth. Okay, so please don't confuse in the exam. The maternal mortality rate is the 88 per 1 lakh, not per the 1,000 beta, per 1 lakh live birth. Okay, so very important. Maternal mortality rate MMR is the 88 per 1,000, sorry, per 1 lakh live birth, not for the 1,000, per 1 lakh live birth. Okay, so this is the important. Then the under 5 mortality rate, the under 5 mortality rate is the 29 deaths are happening per 1,000 live birth. Okay, the sex ratio at the birth is the 917 per female are there per only 1,000 males. Okay, for 1,000 males only 917 females are there. Okay, so now the dowry system becomes return. Previously what we can say, a woman's the girl father or the girl mother used to pay the amount for the boy's side. Okay, so that is the dowry system was old one. Now the dowry system is returned. So now the boys side people have to pay the money towards the girl side people for the taking one girl in their home. Okay, so that is the very important. Yes, it is the time with switch and the everything will get changes, because the sex ratio, when we will see now, only per 1,000 males there is 917 females are there. So that is what our current sex ratio in India, that is the 917 females per 1,000 males are there. Okay, so then the neonatal mortality rate is the 19 deaths per happening per 1000 live birth. Okay, so if you unable to remember all things, please do remember the three things at least. One is neonatal mortality rate, that is the 19 death per 1000 live birth. Okay, so one is the sex ratio, that is the 917 of females per 1000 males. Another one is the maternal mortality rate, so that is the 88 per 1 lakh of the live birth. Okay, so along with that, very important one, last one, that is the infant mortality rate. So please do remember 25 deaths are happening per 1000 live birth. Okay, so these are the important one, right? So if the question is coming, the lowest under 5 mortality rate and the neonatal mortality rate seen in which state? The lowest under 5 mortality rate and the neonatal mortality rate seen in the Kerala states. Okay, so because of the good nursing care in the Kerala states, so we are very proud about the Kerala nurses, because they are the main key role for the achieving this 1000 milestone, very important milestone. Okay, so it is on the 1000 star, more than the 1000 star milestone, where the lowest under 5 mortality rate and the neonatal mortality rate we will see in a state of the Kerala, because of the good nursing practice and the good nursing care. Okay, very important. So this is a chart where you will get the one question in your exam. This is the chart I have already shared in our WhatsApp and the Telegram channel. Okay, you will get it there. Okay, again I will share in the after the today's session. Okay, so if you are still not a part of our WhatsApp channel and the Telegram channel, the link I have given in the description box, so you can get it from there. Okay, so very important, right? So I hope that today's session every one of you have enjoyed. And here is the assignment question for you all. Okay, at the down just mention the what is the current maternal mortality rate, what is the current neonatal mortality rate, and what is the current infant mortality rate as per 2025 sample registration system. Okay, so very important, all this one you have to comment in the comment box. Okay, at the end of the video. Hope it is clear to every one of you and you people have enjoyed the session. And again in the tomorrow session with the same energy, with the same high yield content and the very important content, and the content which will strikes on your computer screen in your mains exam. So I will come up with that one. So stay connected, keep motivated, and motivate your friend also. Okay, so don't compare yourself with others, and don't compare your score by seeing the YouTube channels. Okay, so the aims is there for your result, don't have to worry. Okay, keep practicing the thing. Okay, we will meet again after the this session in the tomorrow session. Okay, so tab tak ke liye jai hind, jai bharat. Okay, I have given the link of the WhatsApp channel and the Telegram channel in the description box. You can join from there. And one more important point to tell you all, so that's the all India level free Norcet mains preparation live test is going on in the master nursing classes app. There is in the all India free Norcet mains same pattern live test is going on every day till your mains exam, for the better practice of the real-time exam situations. So you can download the master nursing classes app and you can get enrollment from there, and you can attend the live test till your mains exam free. Okay, so thank you so much for watching the class till the end. We will meet again in the tomorrow session. Tab tak ke liye jai hind, jai bharat. Bye bye, take care, love you. Don't waste your time, because time is gold for us.